Good morning.
Good morning, everyone.
Welcome to
Welcome
Monday.
to Monday. Yeah. Hey, I was going to say that. You took my joke.
We are
My joke.
the same.
Welcome to Monday, everyone. The nursing school show.
Ask me anything.
I am Matthew.
Not him. I'm Christina. Nice to meet you.
We answer
Welcome
nursing
back.
school related questions. And
Yes.
yes, by ask me, I don't mean me. I mean me as in Christina.
The other half of Matthew.
So,
There you go.
yes.
Sweet deal, friends. How was your weekend?
Oh, boy.
/ if you have questions for me about nursing school, post them in the chat. /
Exactly.
comments if you're on YouTube, Facebook, Instagram, wherever you are in the world.
Wherever you may be, go ahead
Mhm.
and ask your nursing school related questions. We are here to help you out.
Mm-hmm. Shall we start with some questions from last week, though, that we didn't get to?
Sure, we can definitely start with
Let's do
that.
it.
Let me see
Good
what
morning,
we have
Jess.
here.
Good morning, Diana. Hello.
Let me see here.
Let's do it.
You know what? We've had this question for a little
Mhm.
while, but and I think we've probably addressed it in the past, but just want to address it again. What is your opinion on ADN versus BSN programs?
Mhm.
Is the BSN harder or faster paced? Would it be better to do ADN and start working to do BSN while working?
Yeah, do BSN.
Yeah.
A lot of people do that.
Yeah.
Okay, let's talk all things ADN BSN. In the chat, let me know. Are you in an ADN program? Are you in an LPN program? Or are you in a BSN program?
Or other.
Or other.
Or other, yes.
We get emails sometimes from like veterinarian students asking for tips. I'm like,
oh,
I don't know.
That would be the other category.
I don't know. That would be the other category. Anna, you're an LPN.
All right.
Timmy, ADN.
Rachel BSN.
BSN. Well, there's all of them right there.
No vets yet.
So, LPN or LVN program, ADN or a BSN. So I have an ADN. I have a bachelor's in something else. Then I went to my ADN. And so I can't speak to a BSN program. What you will learn there, from what I understand, is it's more like nursing leadership and research based. I've looked at curriculums for BSN programs. That looks to be mostly what it is. It's a lot more like research heavy, evidence-based practice, those things. ADN program is more like, here's what you need to know to be a nurse. Competence in nursing, taking care of patients safely and competently is, the ADN is, if you're in a BSN program that's like all 4 years, you will do your ADN piece in there. You learn all the content, you learn the skills and everything. And then, your last semester or two, you will have more nursing research, those kinds of things. So that's kind of the difference from my understanding between the two. Was there a question about LPN? No, I just asked that. Okay. Yeah. Is the BSN harder or more fast paced? I don't. It depends on what program you're going into, because there are BSN programs that are called BSN programs, accelerated BSNs. And yeah, those are like, they condense 4 years of nursing school into like a year and a half or 2 years. So yes, that would be faster paced. So if you're, in a situation in life where you want to do that, you just want to do it as quickly as possible, that might be a good option for you. Takes a lot of organization skills for sure. As far as should you go to an ADN program or a BSN, it depends. I mean, like I said, I have an ADN, and to be honest, I don't really have any desire to do a BSN. I've looked at the curriculum. I've looked at programs. I'm not super interested in going back. And then also I have a bachelor's already in something else. And so To be honest, if I were to go back to school, I would probably just go for my DNP because there's that bridge from ADN to DNP if you already have a bachelor's in something else. Like, I don't really see the point in like going and getting a bachelor's in something else. I would rather just do the DNP. So that would be me. It all depends. So if that's what you want to do, like if you want to go to a DNP program eventually and you already have a bachelor's, that's something you'll want to look at, like do an ADN and then the DNP, something like that. But if you, want, if you don't have a bachelor's degree and you want a bachelor's in nursing, great. It's also something you'll want to look at what facilities in your area, what they're hiring for. There's something hospitals. If you want to work in a magnet hospital, it's like a status of hospital that the vast majority of their nursing staff has to have a bachelor's in order for them to maintain that magnet status. So it's very important for those facilities to hire BSN graduates. So if that's where you want to work, most likely a BSN. If you have other facilities or hospitals in your area that hire ADNs and LPNs, great, do that. I think it's very variable. There's been a lot of research on, if you're a BSN nurse, a BSN prepared nurse, the patient outcomes are better. So there's a lot of research on that. And that's why the magnet hospitals, that status came to be. Side note, I haven't really looked at that research. I've just heard that that's what it was, but I haven't looked too deeply into that. But that's what I've heard. What else? Did I miss something? I feel like I'm missing something.
No, I think those are the main things. It's interesting just seeing some comments from everyone else too. I wish I'd done my ADN as a non-traditional student. I could work and do online BSN.
Oh, yeah, that was the other thing. Okay. Yeah, you can work, absolutely. And you said plus it's cheaper. ADN, when we were looking at the cost for ADN versus a BSN program in our area is insanity. Like an eighth of the cost. So an ADN program is like in our area here was like an eighth of the cost of a BSN program. Like not doing BSN program here in this area, like to go to school, like physically. This was pre-COVID. So if you have an ADN, exactly like what you said, you can do online ADN to BSN, or RN, whatever they want to call it, RN to BSN, ADN to BSN programs for a lot cheaper. So cost is definitely.
And then Jess is even saying I'm in an ADN program with an automatic entry into online BSN at the same school. So that's cool too.
And that's kind of how ours was too.
Yeah.
They had the college that I went to was kind of linked to a university in the area. And so if you graduated from our nursing program, you were automatically accepted into the BSN for the RN to BSN program. Yep, which is really nice that they do that.
Yeah, so a lot of people have a lot of different perspectives as well. So I think one of the things that I keep latching onto a lot is it harder or faster paced? And I think that really the things that you learn are different in ADN versus BSN. So like you said, it does seem to be a little bit more research based oriented or more during research.
Yeah.
So it might be just down to personal preference also on what kind of practice do you want to do after.
Yep, absolutely.
So just keep that in mind too.
Blue is so cute. Sorry, I don't want to say that. In my state, the hospital systems prefer BSN nurses. If they hire you with an ADN, they require you to get your BSN a specific amount of time. We're seeing that a lot. Now. New York. What other examples are there? I know of New York that in 2010 said that in a decade, 80%, 70%, something like that, 75%, 3/4, 80% of their nurses, they wanted to be BSNs. I don't know where that's at. I don't live in New York. But that's what I've seen from that. So that is a good point. Depending on your state might want you to do a BSN track rather than an ADN track and get all the hospitals hiring BSN graduates rather than ADN. So you will definitely want to look into that and see what will be required of you moving forward.
Sure. Yeah.
Because also, like, if you don't want to go into an ADN program and then know that 3 years down the line, they're going to say, oh, you have to get your BSN, if you might as well have done the BSN if that's what you wanted to do,
Laura, do you have anything more specific about what of accelerated nursing? So
Yeah, I kind of touched on that
yeah.
a little bit. Accelerated nursing is like the accelerated BSN, so a BSN, and so that would be like a BSN program that is condensed. I think condensed is probably the best word for it. Condensed. So it's like taking your 3 or 4 year bachelor's of science program and condensing it into a year and a half, or 2, depending on the program. Like I've seen like 12 months, I've seen 18 month, I've seen I think even like a 24, 21 month BSN. So however long it does it, but it is just condensing it down into shorter time periods so you can graduate sooner, graduate quicker. Now, I will note in our area, those are more expensive. And so we mentioned cost a little bit. ADN programs, LPN programs are going to be less expensive than a bachelor's. It's kind of like those two tiers. I would say from what I've seen, it's like ADN, less cost, BSN, and then ABSN, accelerated. The accelerated, even though it's shorter, costs more. Or at least the one in our area costs more.
Yeah, makes sense to me.
Yeah.
Okay. Very cool.
Yep.
All right. So a couple of people are asking.
Yep.
Is there anything else that you wanted to cover with
I don't think so, unless you
Okay.
guys had questions. I applied for a bachelor program, so if you know something or if you have something that is good to study before this test, please let me know. You applied for bachelor programs. Okay. Yeah, okay. Now we're on to other questions. All right.
Okay.
Hey, Brandy, good morning.
All right. So moving on, we have a couple of people, Lucky, Latoya, and Rantoria.
Okay.
Any tips on passing a pharmacology and med surge? I'm kind of nervous starting the term. Latoya, tips on med surge, and Rantoria. Hey, I start med surge and I'm scared. Any tips? So
that is what
let's start
Sarah
with med surge.
too.
Med surge and then pharmacology.
Okay, cool. Let's do med surge. So the nursing school study system, do you guys have this yet? The nursing school study system, you go to nursingschoolofsuccess.com/study system. Get it now. It walks you through everything you need to know how to study for nursing school. So like this is how to study in nursing school step by step. We walk you through how to study in nursing school from start to finish. Pretty amazing. So on page 34, starting on page 34, we talk about how to study med surg. So there are really 4 main categories that you need to know for med surg. Only 4. I know that your nursing instructors are going to tell you read every single thing in the textbook. They are wrong. Do not listen to that. Simply for the sheer fact is that it would be impossible to read everything in your textbooks and be able to critically think about it and apply the information before your exam. You could spend all of your time reading the book for the sake of reading the book before your exam. But when was the last time your nursing exam tested you on random facts from the textbook? Like never, right? What they're going to test you on is case scenario questions. They are going to give you a case scenario, like a patient situation scenario question, like a case study, and they're going to ask you questions about it, which means that they're not testing you with random facts from the textbook. You need to know facts from the textbook, but also you need to critically think about them because that is what they're going to test you on. They're going to test you on how well you synthesize that information in that case study. Can you apply what you've learned and critically think about it? So that's what they are going to test you on your exams, which is why we say do not read every single thing in the book for the sake of reading. That is a waste of time. What I want you to do instead is focus on these 4 main categories that I'm going to tell you right now. Focus on these 4 main categories and then spend the rest of the time learning how to apply those 4 main categories together and to other things. Okay, so let's go. 4 main categories. Here they are. You ready? Write these down. Pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. Those are the 4 main things that your tests are going to test you on. Okay, did you get that? Can someone like write them in the chat so everyone can screenshot it, like the chat? I think that would be helpful. Can someone write these 4 categories in the chat, both on Instagram, Facebook, and YouTube? Who wants to get it first? Are you ready for it? Someone post it first on all platforms, okay? Instagram, Facebook, YouTube. Write it down in the chat for everyone else to see. Pathophysiology, signs and symptoms, nursing assessment, and nursing interventions, okay? Pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. Now, here's the kicker with this. Here's the kicker. Pathophysiology is the foundation for everything else you need to learn. It is so much easier to understand the signs and symptoms, the nursing assessment, and the nursing interventions when you know the pathophysiology. So much easier. You have to understand what is happening in the body before you can understand the other 3 categories, because the signs and symptoms are going to be reflective of that pathophysiology. Then those are the things you're going to assess for, right? The nursing assessment is going to stem from that pathophysiology. You have to understand what is going on in this patient. What could it possibly be? Here are the things I'm going to assess for. And then interventions, of course. Interventions, we have to go back to the pathophysiology. What is happening? You guys are amazing. Thank you. Blue, Blue is this? Blue, I don't know. Yeah. Brandy, thank you. You guys wrote it down. Ibrahim, pathophysiology, nursing assessment, signs and symptoms, nursing interventions.
Esperanza, focus on the main categories.
Thank you. Pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. 4 main categories. Okay, for studying med-surg. Now, we do have this listed out, and I walk you through how to study med-surg a little more in depth in the nursing school study system. So check that out. We also, on page 17, see, I got it memorized now. Page 17 of the nursing school study system, we walk you through how to critically think. So how do you apply these things to your, how do you critically think about it and apply it? So when you get to your nursing school exam, you're not like freaking out because you just memorized a bunch of facts. No. We walk you through how to study. How to study. Stacy, you said any helpful tips for pediatrics? Yes, this. Pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. 4 main categories, okay? Cool. If you are a nursing SOS member, please do not go and buy the nursing school study system because it's already inside the nursing SOS membership community for you for free. So if you are a nursing SOS members, there you go. Nursing school study system, log into your dashboard, click on the nursing school study system, download it. I'm sure you have already, but if you haven't, do it now.
So someone was just asking, what is this booklet? Is it helpful? So if you can just give an overview of what it is.
Yeah.
And then they're also asking, does it get updated often? Don't want to buy it now. And then it gets updated, have to buy it again. So
no,
those kind of questions too. So just what is it?
Mm-hmm.
Is it helpful? Let's start with that.
This is a nursing school study system. Yes, it is helpful. This is your step-by-step guide for how to study in nursing school. So we walk you through everything. And it's clearly laid out here on so on each of these top pages, you'll see step 1. Like we literally walk you through the steps of how to study through nursing school. It is I can't even. It's amazing. If you don't have it, please get it. If you are a nursing SOS member, don't get it because it's in the membership community already for free for you. So it walks you through step-by-step how to study in nursing school. Basically what we did was I've been teaching nursing students, tutoring nursing students, coaching nursing students for about 3-4 years now. And over the summer, we started these live videos a few times a week. So we come here and we answer your questions. And then it was right around September, October, where I said, you know what? I really need to put everything I know about how to study in nursing school in one condensed place. It was always in the membership community. It was always how we teach in the membership community. But I wanted to put all of our study tips in one condensed place. And so that's exactly what we did. So we put everything that I know in my brain about how to study in nursing school and put it inside the nursing school study system in a clear step-by-step process for you to follow. So you do not have to get overwhelmed or confused about how to study or what to study, or I don't know what to do. All of that ends here. Because this is your key for how to study in nursing school. It walks you through step by step exactly what to do. It is so, so good. So that is that. Does that answer that question?
Yeah, that answers that question. So if you're interested in getting that, that's at nursingschoolsuccess.com/study system. It is a PDF download, so you can either just keep it on your phone or you can get it printed out like we have here. But it is a PDF download. So
yep.
There you go.
Brianna, yes, we do save, as long as Instagram lets me, we do save these lives to stories. And then our IGTV, we save it to IGTV, and then on Facebook, we save them, right? On Facebook?
Yeah.
Okay.
They're all on Facebook. They're also all on YouTube as well.
Oh, yeah, they're all on YouTube too.
Yeah.
That's right. Hello, YouTube.
Yeah. We're in all
of course,
the places.
we're in all the places.
So, yes.
So if you guys want to watch this back, no problem. Go to YouTube, watch it back on our channel.
Yeah. So, Brandy, you were just mentioning also that just wanted to shout you out.
Yay,
rock your second attempt at Dosage Calc with a 90. Live to see another lecture day. So, yep.
That Dose Calc stuff. Hey, Brandy, have you checked out the Dose Calc course inside the community? Check it out. You'll like it. Yeah.
Yep, there you go. So Akira, how to successfully pass med surg. So we're just talking about that right now. So there are four main categories.
Four main categories. Pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. Pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. Those are the four key things that you need to focus on when you are studying med surg, and not even just med surg. Pediatrics as well. Mental health as well. Critical care. Fundamentals, if you're doing fluid and electrolytes imbalances, if you are doing ABG imbalances like metabolic acidosis, metabolic alkalosis, all those things, you will also in fundamentals most likely learn about stroke, heart failure, and diabetes are the three main ones. Kind of the high level overviews of some of the most common med-surg disorders you'll learn in fundamentals. Those four main categories. That's what you got to do.
Interesting. Rebecca
so easy.
Is asking any tips on maternal newborn.
Yes.
And she's in the LPN program.
Yeah. So from my understanding in your LPN program, what you will want to focus on, again, those four main categories. The biggest thing is that the nursing assessment is going to look a little different for you. The nursing assessment is not going to be what we like the nursing assessment. It's going to be an LPN assessment where you're mostly collecting data and then relaying that data to the nurse. Does that make sense? But everything else should stay the same. Let me know if that's not the case, because I would like to learn from you and how your program does it. But Rebecca, yes, pathophysiology, signs and symptoms, the nursing assessment for LPNs, and the nursing interventions. And of course, nursing interventions as well for LPNs, but you also have to know, what the RN is going to be doing, even in ADN or BSN programs, we have to learn what the doctor might do, so you kind of got to know those things. But, Yep.
All right.
Good.
Cool. And the other topic that they were asking about tips on is pharmacology.
Oh, that's right. Okay.
Yes. So again, pharmacology in the study system.
Yes. It is in the nursing school study system. It is on page How to Study Pharmacology in Nursing School, page 22. Okay, so I am going to go to my drug guide though.
Oh, look,
there are. Yay!
These are both the old ones. You want the newest version edition?
Yep. Make sure you get the updated Davis drug guide or the updated drug guide. I know there's a lot of other drug guides out there. I really like the Davis one. Davis's.
Davis does it well.
I really like this one. I just do. So just make sure you have the updated version, because actually, can you pull that back up and like compare them side to side? I think is so funny. So this is from like what, 4 or 5 years ago. And then this is from last year's. There's a new one, but look how, I don't know if you can really see that, but this one is so much thinner than this one. It's like they added 1,000 meds or something.
Something happened.
Something happened.
Maybe, I don't know, maybe they'll just keep getting bigger and bigger. Who knows?
I think so. You know, it's you know, every year things change. I know they pull, you know, they pull meds off the market. That happened this past year. And then they add more. So make sure you get the updated. That's why it's so important to get the updated drug guide.
It's a funny story about that. Brandy was just mentioning that, yes, you did get in the dosage calculation course, and that's how you passed your second attempt after failing the first attempt. So cool. We're glad it helps, and glad that you think it's great. We were putting that all together. It's been going on for a while, and there was one medication in there, right? They were like, okay, let's study and do this. And upon research, found out that they actually pulled that off. So
it doesn't exist anymore.
That medication is not in the dosage calculation course.
Not in the medication database for members. Nope, not there anymore. So yeah, we'll try to keep that updated and add like updated meds. So Matthew is referring to our medication database inside the membership community. So if you're a Nursing SOS member, you already have access to this. We have over 120, 130.
Over 120. Over 120 or 130
medications in there. So you don't have to go to, you know, a textbook or anything to try to learn your meds. Let us do the hard work for you. We teach it to you. So you could just pull up a video, and they're like quick videos where we walk you through the critical thinking for these medications that you learn in nursing school. So you don't have to do it by yourself. Like, you don't have to learn nursing school alone, my friends. That's what we're here for. We're here for you. Don't worry about it. It's going to be great.
And if you're actually teach it to you. Interested, if you're not part of the Nursing SOS membership community, we actually have this as a standalone course as well. So if you just go to nursingSchoolOfSuccess.com/shop, all of our things are there. So we did pull that out, and you can just get this as a standalone course if you want the medication database.
I parted my hair in a different way today, so it's doing kind of funny things. You're like, wow, Christina, your hair's kind of... I know. A little unruly this morning.
My hair's getting long.
It is getting long.
Yes. This is long, by the way. BT dubs.
BT dubs. That's awesome. Okay, let's get back to pharmacology, my friends. Davis's drug guide. Please get it, and please get the updated version. Please, friends. So again, 4 main categories you are going to want to focus on, okay? For this one, it's the mechanism of action. Mechanism of action for the medication. Side effects, then nursing assessment, and then nursing considerations. Again, 4 main categories. Mechanism of action. How does the medication act in the body? Mechanism of action. Side effects. What are the side effects of it and why? Like, connect the side effects back to the mechanism of action. And then the nursing assessment, what are you going to assess for before, during, and after administration? And then nursing considerations. You know, other things you want to learn. Other things you need to learn, like the antidote, any intricacies about giving it, any, you know, just things that you have to be aware of for the medication. Some medications don't have a ton of things. Some have a lot, and like how to administer it and things like that. Like if it's an IV push medication, it's going to be a lot different than if it's like a oral PO med. So thankfully, you don't have to read all of your textbooks to learn the meds yourself. So friends, I'm telling you right now, if you are not inside the Nursing SOS membership community, you definitely want to join. And if you just want the med database, that's totally fine. Go to nursingSchoolOfSuccess.com/shop. You can check out that medication database course in there for you, where we walk you through what you need to know for each medication. Like, I do not want you to be confused about meds at all. We walk you through the mechanism of action, what you need to know. We do the critical thinking for you and help you develop your critical thinking skills for yourself. We walk you through the side effects of the medication. Why? Why do those side effects happen? Why do they happen? Nursing assessments. Why are we going to assess for these things with these meds? And the nursing considerations. Why do we have to do it the way we do it? So those things, I got to tell you, friends, this is everything I wish I had in nursing school, because nursing school is tough and more challenging when you have to do it yourself. When you feel like you're alone, it's frustrated. It's frustrating when you are left to your own devices, and you can't ask questions from your instructor. Maybe they're not around. Maybe they're not responding to your emails. Maybe, especially with this online environment, you might not have classmates that you can talk to. This is why we created this. Let us walk you through nursing school step by step. We will teach you what you need to know, so you do not have to figure it all out yourself. That's what we're here to do. We're here to walk you through it.
She's here. I'm here just to talk with you guys.
He's here for comedic value.
Exactly. And I think I actually misspoke because I kind of conflated two topics there because I was looking forward to our next topic.
Yay!
So the topic that we just finished talking about is pharmacology, the medication database. We have a standalone course for that in our shop.
Yep.
The other thing that we wanted to talk about was what Brandy was talking about, which is dosage calculations,
whoop, whoop.
Which also we have a standalone course, or it's all in the membership community if you'd like that.
Mm-hmm.
But Tori and Anand was asking about IV push calculations and IV drop calculations.
Ooh, yeah, so good.
So let's talk about dosage calculations a little bit.
We have a very distinct step-by-step process for walking you through dose calc and how to get literally every single dose calc question right. Because, friends, as you know, when you get into nursing school, you will have a dose calc exam right, like in the first 2 weeks. In the first 2 weeks of your nursing school program, you will have, or whatever term you're in nursing school, you will have a dose calc exam, and you have to get 100% on that test. Or you will need to retake it, or you get booted from your program. We've all had this experience, right? This is a thing in nursing school. Some nursing schools do allow you to get maybe 1 or 2 questions wrong, but try to get all of them right. You really should get all of them right. So that is why we have this step-by-step process for you. So if you are on YouTube, you're on YouTube. All of you guys have access to YouTube. You have access to YouTube. You're on the internet. Go to YouTube, type in Nursing SOS Dose Calc. And we actually just put together weight-based last week. We released weight-based dose calc questions.
Feeding tube the week after that.
And feeding tubes. And we have one on IV. So you were asking about IV and IV pushes. Check out the IV one. And then we also have one on PO meds.
So I am actually editing one today for us to put up on YouTube tomorrow.
You know what that one is?
We put not off the top of my head. I do not know what that one is. I do not.
Okay.
I do not know.
I'm pretty sure it's heparin.
But
check it out.
I'm editing that one today. We are posting YouTube videos again every Tuesday. So we're right now doing a dose calc series or what have you on different kinds of dosage calculations. So definitely, if you're not yet, hit subscribe, hit the bell so you're notified when that goes up. It will be going up tomorrow at some point in time.
Yep, absolutely.
So, yes.
Make sure you are subscribed and hit the bell on YouTube so that you do not miss out.
Exactly.
And, there you go.
All right. Ebony is asking about EKGs.
All right.
Hello, I'm going to my 3rd semester. Any good way to learn how to read EKGs? And I remember going way back. You have a blog post, right? Pre-YouTube.
Probably pre-YouTube. There's a lot of pre-YouTube things.
About EKGs, but I don't know. Yeah. So any quick guidelines on that, or do we have any YouTube videos on that?
We have a tutoring call inside the membership community on EKGs.
Okay.
So yeah, we have a tutoring call. We have a video on EKGs inside the membership community. I don't think we have anything on YouTube that I can remember. I don't know if we have anything on the blog about it. I think you might be thinking about heart sounds. Are you thinking about heart sounds?
I don't know. Maybe. I don't know.
I don't remember.
It was a long time ago.
Okay. My best advice that I can tell you on ECGs is to literally follow it with your finger. It sounds so simple, but follow it with your finger. Trace it. You're like, P wave, QRS, ST, P wave, QRS. And then you'll notice if one of them is not there. Literally follow it with your finger. Like, that is the best advice that I got in nursing school that will like save you. That's all. I mean, that's all. That's really my best advice for that. For learning what is what. Flashcards also is something that I did for ECGs was
I think I remember
flashcards.
seeing those flashcards.
Yeah,
Yes.
so I would print out strips and then write everything I needed to know about it and just do flashcards. Those are ones that I actually did go through.
Okay.
The flashcards.
Oh, good. Good.
Those are ones I actually did go through. Oh, and Ebony, also something that could be really helpful is to actually draw it out yourself. Because this is something, if you're a visual person or even like kinesthetic, right? Draw it out yourself, P wave, QRS, ST. There you go. Draw it out. P wave, QRS, ST. Draw it out. Draw it out yourself. Or like print it out, I don't know. Print out strips if you can, but draw it out. I think actually drawing it out is probably the best thing to do.
Okay.
Yeah.
Really cool.
That is my biggest tip for ECGs. It sounds so simple, but nobody does it. So trace it with your finger. You will be amazed. There you go.
All right. Esperanza, any update or any help for ATIT's entrance exam for 2021?
Good question. I do not know very much about the T's basically at all. Other than you need to take it to get into a lot of nursing programs. So I send you over to Kate at prenursingsmarter.com. Her name is Kate, or Instagram at prenursingsmarter. There you go.
Cool.
That's all I got for the T's, to be honest with you. I know. But we help students with their core nursing classes, and the T's is not really part of that. T's is really to get into nursing school. So there you go.
Crystal, I just got the study guide. Is it a one-time access or a downloadable PDF? So it is a downloadable PDF. So go ahead and log on in and you'll see the study system course, and you go in there and there's actually a couple different PDFs in there for you to take a look at.
We've got like printing instructions.
Yeah,
in
printing
there too,
instructions and
all the stuff.
All the goodies there.
So. All the goodies there.
Yes.
Yeah, there's some bonuses in there too, right?
Yes. Yeah, they are.
Ooh, bonuses.
So we like the bonuses. So
all right, Crystal, enjoy your study system and bonuses. Wink. This is again my wink that I can't. Nope. Actually, our 3-year-old, has he done this with you?
No. What is he doing
now? He says, Mommy, look at me, wink. And he goes like this. It's so cute. Oh, man, it's adorable. So that happened.
No, he has not done that with me yet.
He like covers his eye and then just closes and opens his eye. Preschoolers. They're the best. Oh, man.
Jenna is asking, how can you properly study... Okay, I'm reading this right. How can you properly study electrolyte imbalances?
How can you properly study electrolyte imbalances? That's the question?
That is the question.
Okay. Let me think about this. Properly study electrolyte imbalances. My best advice for this is what we always do. Pathophysiology, signs and symptoms, nursing assessment, nursing interventions. Best way to study electrolyte imbalances? Is that what you were thinking?
So, like any other med-surg
like anything
topic,
else.
it's back to those 4 main categories. So you need to know the pathophysiology first. So you need to know what's going on and what's wrong in order to do the other 3: signs and symptoms, nursing assessment, nursing interventions. So properly study is understanding, the pathophysiology importantly, so that you can move on to those other categories. But it's just like any other thing. It is the 4 main top categories of med-surg. Yep.
So with electrolyte imbalances, we're talking about things like hyperkalemia, hypocalcemia, like those, like calcium, magnesium,
Hypos.
all the hypos, sodium, potassium, all those things, like the hypo.
Hyper.
But it's like weird because I do with my, okay, hypo. Yes, all of those things. You really need to know the pathophysiology, like what is happening. What is happening during hyperkalemia? You have to understand that. And then what are the signs and symptoms that you would expect to see in a patient with hyperkalemia? And then what would you assess for? And then what are you going to do about it? What are you going to do about it? So those are the 4 main categories. Really, really got to know those things. Wink. I'm going to wink again. I wink a lot. Like, I think that we forget that, especially with fluid and electrolytes. Because there's like a lot of fluid and electrolyte imbalances, right? You often learn it in fundamentals. You get to nursing fundamentals and you're freaking out because you have no idea how to study. Get the book. You have no idea how to study in nursing school. And then all of a sudden you're presented with these fluid and electrolyte disorders and you have no idea what to do because it's very overwhelming. 4 main categories: pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. It really does not get easier than that, my friends. Okay, wait, I'm going to take it back.
Oh, okay.
It does get easier than that, to be honest. If you are a Nursing SOS member, you knew what I was going to say, right? If you're a Nursing SOS member, we have an entire fluid and electrolyte course for you inside the community. So we do those things for you. We help you critically think about all those 4 categories about fluid and electrolytes. We literally walk you through everything you need to know about fluid and electrolytes in the fluid and electrolytes course in the membership community. So I get so excited about it. There you go. I mean, it does get easier because watch a video and we'll explain it to you.
So I think the main takeaway here is to go ahead and go to nursingschoolsuccess.com/shop because we do have those in the membership or as a standalone course. We actually pulled it out and made a nursing fundamentals course, and fluid and electrolytes is included in there. Mm-hmm. So go ahead and take a look at that if you really want a guided tour. No, that's not right. Guided experience.
Guided tour through nursing school. It's like we're all getting on a train and we're like, let's go to nursing school together. That would be fun.
If you want a little bit more help from Christina on nursing fundamentals and fluid and electrolytes, that's where to go.
That's what you want to do.
That is what you would do.
Crystal, how do I get that book? Is that the guide you purchased? This is the nursing school study system. So I'm pretty sure that is what you bought. I don't know. You just said you bought it, right? You just bought. It's called the nursing school study system. So if it looks like this, when you look at it up on your screen, it's a PDF download. If it looks like this, then yes, that's right. There you go.
And Esperanza just asking, she wasn't able to catch Kate's info that you shared with pre-nursing. So it's pre-nursing.
Oh, for T's?
Yeah.
Yeah. Kate at prenursing.smarter.com. Okay. Kate at prenursing. That's not right. Okay. It's prenursing.smarter.com. I realized that I probably said that really confusingly.
Yeah.
Prenursing.smarter.com. And her name is Kate. Check it out. So prenursing.smarter.com. She's also on Instagram at prenursing.smarter.
Okay.
So at prenursing.smarter on Instagram. Maybe Facebook too. I don't know. But at prenursing.smarter or just prenursing.smarter.com. Her name is Kate. And yay. Shout out to Kate.
Yeah.
There you go. So that was for ATITs. For ATI, that question was for the T's,
it's
right?
for ATITs.
Okay. Oh, okay, good. Yep. Okay. All right. Anybody got any questions on ATI? I have tips. Hey, also in the nursing school study system is how to study for ATI and HESI exams. We also talk about how to ace your finals. We talk about what to do if you fail an exam. That is on page 56. What to do if you fail an exam. And then we also talk about everything. How many hours should you study? What to do if my professor wants me to read everything in the textbook? What to do if my professor doesn't teach? How do I pass ATI and HESI? I already said that. How to study mental health, how to learn meds faster, everything. Everything.
Okay.
There you
Lynn's
go.
question is interesting.
Okay. I like
Hi, I am
interesting.
about to start fourth semester,
Mhm.
and I want to raise my grade. What should I do at this late point?
And want to raise my grade. Okay, yeah, go for it.
Yeah. So I think the thing that I found interesting is at this late point. So you're in fourth semester. How many semesters do you guys go through?
It
I don't know,
depends.
but
I mean, it
I don't know
depends.
how many
Yeah.
semesters do you have in total. So it sounds
Yeah.
like a late point. But I think that the first thing to understand or recognize from a mindset perspective is that it's never too late, right? So it's great that you're asking now. So
Do not give up. Never
do-
too late.
I'm not going to repeat that. So yes, at this late point, what are you gonna or what can they do to raise their grade?
Oh, I also want to ask, like, so you have four, so you're in your final semester. So, from my understanding, or from my understanding of schools in general, your classes are taken in isolation. So, like, the grades you got from last semester are done, right? Like, they have no bearing on your grade this semester. Are you asking about raising your GPA? Or are you asking about raising your grade, which I guess is kind of the same thing ultimately?
Yeah, so
but
that is a good question. Whether it's
I
a
just kind of wonder.
if you're wondering about your cumulative GPA and do you need a
Yeah.
cumulative GPA to be a certain level for something? Do you plan on doing something beyond that they have a minimum GPA, or
Yeah.
is it a particular class that you're struggling in and that you need to raise your grade in that? So
Mhm.
I guess those are the two options there.
But I guess ultimately, like, if you raise your grade, then your GPA will go up, right?
Mhm.
So, I don't know, what class are you taking? That's really, I have so many questions for you, Lynn. I'm sorry. What class are you taking? Because my advice is going to change depending on what class you're taking. Now, like I said, this is your step-by-step guide for how to study in nursing school, and it walks you through the classes. Like, what do you do? How do you study for each class you're taking in nursing school? Med-Surg 3. That's helpful. Page 34 of the nursing school study system, where we walk you through how to study. And also, you're most likely, if you're in your last term, you're probably doing critical care as well. What'd she say? I can't really
Okay,
read
yeah.
that.
So basically, Lynn, what you're saying is you want to just raise your grade for the nursing program. Last semester you did pass. You passed with a C, so you just want to raise your exam score so you can get better than a C this semester, is what I gather.
Okay.
So yes, you are in Med-Surg 3. So
Lynn, I'm telling you, please get the nursing school study system. Are you a nursing SOS member? I don't think so. If you are not, please, are you? Yes? Friend, download the nursing school study system right now. Go check it out. Download the nursing school study system. Oh, you are not a nursing SOS member.
yes.
Okay.
Sorry. A little bit delayed there. So
questions too fast. Go to nursingSchoolOfSuccess.com/study system. Download the nursing school study system, because it is going to walk you through step by step how to study in Med-Surg. And then also, Lynn, I want to mention, so page 34 is where you're going to want to start for how to study Med-Surg. But then also on page 38, starting on page 38, we walk you through how to answer nursing school exam questions and NCLEX exam questions. That is what you are going to want to do. So start on page 34 when we talk about Med-Surg, and then quickly move on to page 38 through wherever, 41, several pages, where I walk you through how to answer nursing exam questions or NCLEX style questions. So friends, if you do not have the nursing school study system, I'm telling you right now, please go grab it. I cannot tell you this enough. This is everything I wish I had when I started nursing school and in the middle of nursing school, when you just have no idea how to study. This is your roadmap. This is your step-by-step guide for how to study in nursing school. So go to NursingSchoolOfSuccess.com/study system. NursingSchoolOfSuccess.com/study system and check it out. If you are a nursing SOS member, it's inside of the membership community for you already. So, don't go buy it if you're a member, because you already have it. Yay. You should have already downloaded it if you're a nursing SOS member, because you get emails from me about downloading.
That's true. I think that's like the very, very first
It's the
email you
first
get
thing you
when
should do.
you get the membership community. So,
First thing you should do. Yep.
can you post a link? So unfortunately, I can only type in on YouTube right now while we're live. But nursing-school-success.com/study system.
Yep.
We'll get you there.
There you go.
So.
Yep. So yeah, we'll also walk you through in that study system how to answer nursing exam questions better and easier. So awesome. Pure gold. Oh, got it. Thanks. Perfect. Lynn, I'm glad. Sweet. Alrighty. What is next?
Let's do this.
Okay.
This isn't asked very often, but can you explain the nursing process?
Sure. Can you explain the nursing process? Well, basically, the nursing process is the process we go through in nursing.
Very good. All right.
I know. I was just thinking about this the other day. Like, you can't use the words in the definition of the word.
You're definitely not supposed to.
Like, you're not supposed to use it. But I actually was listening to someone explain a term, but they used the word as they explained the word. And that doesn't work. Right? That doesn't work. So, okay, the nursing process is basically, it's a step-by-step sequence that we go through to help our patients. There you go. That's pretty good, right?
Okay.
That's pretty good. It's a step-by-step sequence that we go through to help our patients in the best way possible. So the nursing process, you might hear this acronym ADPIE or ADOPIE. ADPIE, ADPIE. So assessment, diagnosis, like the nursing diagnosis, planning patient care, PI, implementation, or an evaluation. So implementation of implement, like do the things that you planned to help your patient, like do the thing, and then evaluate them. So like basically reassess them. So ADPIE, ADPIE, assessment, diagnosis, planning, implementation, evaluation. So that is the nursing process. It's not this big scary thing. As a nurse on the floor, you're going to be doing this constantly with everyone all the time. When you're standing in line at the grocery store, you're going to be like assessing people. It's just a thing in nursing school. Just get used to it. ADPIE, assessment, diagnosis, planning, implementation, and evaluation. That walks through, our patient care. It's a sequence of patient care and how we help our patients get better. Is that a good explanation?
Yeah, I definitely like that. And we do have a YouTube video.
Oh, we do.
It, right?
Yeah, good point.
Yeah,
good
so
point. Nursing, go to YouTube, type in Nursing SOS ADPIE or Nursing SOS Nursing Process.
Okay.
That should get you there.
Cool.
That should get you to the right video. Yep.
Yeah, I just like that one because I don't think we've gotten that asked lately.
No, it's totally a good video. You really want to check it out. Because I know it's kind of scary when you start nursing school and you don't know anything about anything and your instructors are telling you to read the book and then you come on live with me and I'm like, no, please don't read the book. So you don't know who to believe. I totally get it. But I'm telling you right now, don't read the book. Don't read everything in the textbook. Do the nursing process. Watch our videos. It's going to be fine. It's going to be fine.
All right, let's do this one because it's a happy subject. And by happy subject, I mean not a happy subject. So
let's do it because it's happy. And by happy, I mean not happy.
Yes.
Exactly. I mean very unhappy.
Okay. How do you deal with competitive classmates that are mean?
You don't listen to them. That's basically like how to deal with bullies. Oh, hey.
Yeah.
We did a whole YouTube video about this.
Actually, now that you mention it that way, yes. We do have a YouTube video about bullies.
Yeah, where I read mean tweets. Which is kind of fun.
It's a different YouTube.
It's kind of fun.
Yeah. If you want to take a look at that, how to deal with bullies in nursing school. But yeah, how do you deal with competitive classmates that are mean? And I don't know, I might just be thinking about it too lightly, but with everyone on remote learning right now, or a lot of people, I mean, so everyone that is on remote learning, can't you just mute them Because like everyone's
Mute
there and like
button.
they're there. And if they're talking mean to you, you can just like kind of mute them, right?
Yeah,
So
that's funny.
I mean, I think that's
Unfollow them on Instagram,
I
I
think that's the
guess.
way to do it remotely is just like, and so like you can even kind of like turn off their screen probably, so you don't even have to see them. But even if you see them, you'll see them,
I don't
but
know.
you can mute them and they can be talking and you just don't hear them. So, and that's essentially what Christina was saying, right? With in person is you
Just don't
don't listen to what they have to say.
Yeah.
So
I mean, I know that is difficult because if you really have someone that's like, I mean, our team, they're so funny. Nicole messages me sometimes. She's like, people are really mean. I'm like, don't worry. They're not mean to you. They're mean to me. It's fine. It's fine. Just whatever.
Diana, we do see them at our clinicals. So yes,
Yeah.
maybe my answer is not
Yeah.
a foolproof answer there. You
Yeah.
can't just mute them in real life, can you?
Actually, it's
But-
so funny. I will tell this story. Anytime we've brought multiple people on our team for Nursing SOS. So we have quite a few and have had quite a few kind of frontline customer service people on our team. And that's one of the questions that I ask when we're in the interview process for someone is how well do you handle it? Like, how would you respond if someone comes at you? If someone says X, Y, and Z in a YouTube comment to you, how would you respond? Those things. So yeah, so we asked those. And it's always kind of fun.
Yeah.
Because you gotta ask it because we get it all the time. People really don't like me. What are you gonna do about it?
I think it is interesting, kind of now that I'm just rereading the question over and I'll read it again. Actually, something that I didn't catch here is, how do you deal with competitive classmates that are mean? So it's not just mean. It sounds like there is an underlying reason that you think that there's a reason anyway, and it's competitiveness, a competitive classmates or a competitive environment. So really, this is actually kind of two things. How do you deal with a competitive environment? And probably a negative competitive environment if they are mean.
Kind of interesting because competition in nursing school, like why? Like I understand competing on a certain level to get into nursing school, but if you're already in nursing school, like where's the competition? It's really like it's not like they accept 200 students in a cohort, but only 5 of you can graduate. That's not. I hope that's not
only
true.
the strongest survive.
I don't think that's true for your school. So I think what happens is that we take the prerequisite mentality of like, okay, I have to compete with all the other students around me because we're trying to get into nursing school and I have to compete. And then we kind of take that to nursing school with us. And we don't, move on from it.
Yeah, so this is the interactive part of this live today. So thank you, Diana.
Interactive part.
Yeah, the interactive part. So do you feel this, or have you interacted with this in the past? Do you come across mean classmates because of competition or because of something else? Have you come across this, and what are your experiences? So Diana, your scope is some people don't want to work as a team. So yeah, you guys do have group projects and things like that.
Yeah, group projects.
So is the meanness just refusing to work as a team, or are they actively bring you down as a team, or I don't know what did you experience that in your teams? They were
pretty good. I mean,
right?
Our nursing school was pretty clear, like we don't compete here, get rid of that. Exactly what I said. Like they were pretty good at, like the instructors were pretty good at saying, get rid of your prerequisite mentality. This is nursing school. You're all in this together now, kind of thing. Like you're here, take care of each other. Yup. And so, it's a change. It's a change for sure. And then you can have that conversation with your instructors and other students, like peers too. And also I would say, like, even if that feels like it's everybody. I don't think it's everybody. Like, find a friend in nursing school. Find somebody,
Mhm.
or find, one or two people. If you're nursing school, like your cohort is like 30 people or 20 people, it's not going to be everybody that's super mean. There's going to be people that are like you. That just are trying to ignore it, and those. So find those people, like seek them out, right?
Mhm.
Make friends. Um, you know, like Jesus said, bless those who persecute you. If people are mean to you, pray for them. Pray for those who persecute you. Um, so whatever. Michelle, you said I like you. Well, thank you.
Esperanza,
In
both they refuse to work and they put you down.
mhm.
So
Both they refuse to work and put you down.
yeah.
So like, yeah, for group projects. Yeah. Yeah. I mean, it's just you gotta try your best to work together.
Mhm. Yeah. Give people benefit of the doubt too. Who knows what they're going through? I mean, we're all going through stuff.
Yep.
So who knows what they're going through? But
Yeah. Everyone has their story.
yeah.
Everyone has their reasons.
But
Pray for those who
definitely,
persecute you.
we do have that YouTube video. I totally forgot.
Oh
but,
yeah.
Go
I don't know
to
what it's
YouTube,
called.
search nursing SOS bullies. Maybe.
Try that. Bully. Can someone do that like right now? Go to YouTube.
I don't know.
Type in nursing SOS bullies. See what comes up. I don't remember.
So
what is that called? I don't know. Sorry. Something about bullies.
yeah, I do not remember, but it's a
remember.
good one. It's a good one if you do
is a
have
good one.
problems with that. So just wanted to address that because yeah, it is something that we get questions on once
Yep.
in a while too. So
And also, I just think, honestly, I want to do a Christina Reads Means Tweets video, because this happens a lot where students come to us and they say, all my peers do not like me and I'm having such a hard time. I just want you to know that you're not alone and that your experience is the same as everyone else's experience. Like, we all get those, that it happens. It happens. Like, honestly, here's the thing. When you do things in the world and make something of yourself, people are going to have an opinion about that. And that's okay. I was just watching a sermon yesterday and he mentioned why does, like, it's persecution, right? As Christians, as Jesus followers, we are expecting persecution because that's what Jesus says. Follow me, you will be persecuted. So the world will hate you. That's totally fine. It's completely expected. It means you're doing something right if you're following Jesus. So that's how it works, my friends. I would very much like to do a whole YouTube video about that because I want you to know that you're not alone.
yeah, you're definitely not alone.
Yep.
With that feeling.
Yep.
And people acting the way they do.
Yeah.
So
what are you going to do about it? Pray for them. That's what we do. Yeah. I hope that was helpful.
All right.
There you go.
On that note, we will see you on Wednesday.
All right. Wednesday
party.
At 9 a.m. Pacific Standard Time, noon Eastern.
Mm-hmm. So if you haven't yet, hit subscribe, hit the bell.
Boom.
Be sure to follow us on whatever platforms. And yeah, we'll see you on Wednesday. Come with more questions about nursing school and we'll help you guys out.
Yes. All right, friends. See you there. You guys are amazing. Esperanza, you're so nice. Love you guys. Love your energy. There you go. All right, friends. Have a fantastic.
It's Nursing SOS Dealing with Bullies. Thank you, Arietta.
Oh, Nursing SOS Dealing with Bullies. Thank you, Arietta.
Hooray.
That's the video, Nursing SOS. So go to YouTube, Dealing with Bullies. Is that right? That sounds right. Okay. There you go. There you go, everybody. Have a fantastic Monday and Tuesday and Wednesday morning. We'll see you Wednesday morning at 9 a.m.
All right. Thanks, guys.
Bye.
Bye.
Bye-bye. Bye-bye.